Welcome back to today's episode of Wellness Wednesday. I am Kashidi Long, also known as the Physician Gardener, and today we're going to be answering some questions about high blood pressure. These are questions I've come across with patients over the last week or two, and so I thought I'd share some general answers. Question number one: if I get started on high blood pressure medicine and my blood pressure comes down, can I come off the medicine? No. Once you are on high blood pressure medicine and you are just taking the medicine and your blood pressure normalizes, that means your blood pressure is now controlled. It does not mean you are cured. Medication for high blood pressure, it treats your high blood pressure. It does not cure or reverse it per se. So if you stop taking your medication, your blood pressure will go right back up, and then you will be at increased risk for heart attacks and strokes and blindness and kidney failure. So you will need to keep taking your medication unless you make some other changes outside of the medication. Question number two: is it possible to come off of high blood pressure medicine? The answer is it depends. It depends on the person. Some people have genetic reasons for their high blood pressure or adrenal reasons or other causes that will make it a lot more difficult to come off of high blood pressure medication. And then other people just have like lifestyle factors that contribute, like their diet, their sleep, their alcohol intake. So as you can see, your genetic factors are not modifiable. Your lifestyle factors are modifiable. So if you adjust your modifiable risk factors, a lot of times you can either at least decrease the number of medications you need to use, decrease the dose of the medications that you're on, or even get off of medications altogether. But it depends on the person and their level of commitment to getting off medication. So it doesn't apply to everybody, because I have seen some people who are super fit and eat healthy and they still have high blood pressure. But in America, a lot of the people who have high blood pressure have it because of poor diets. The American diet is super high in ultra processed food, not enough stress management. Everybody works a lot, doesn't sleep enough, doesn't get enough exercise. So those are things that can be adjusted. There's also more certain foods that you can incorporate into your life more that will help manage your blood pressure, and other strategies. There's herbal things that you can take. So really there's some options, but not everybody has the time, energy, the resources to dive deep into those options. So it can be kind of difficult to get off of your blood pressure medication. Question number three, and this goes back to the answer to the previous question: what can I do besides medication to manage my blood pressure? So I'm going to give a brief overview. Of course, there's more in depth to this, but some things you can do: eat a diet that is rich in fruits and vegetables. And you want a variety of fruits and vegetables, not the same ones all the time. There are some that are more supporting to blood pressure than others, such as like beets and dark leafy greens and beans are all very supportive for helping lower your blood pressure. The DASH diet, the Mediterranean diet, and a whole foods plant-based diet have all been shown to help lower blood pressure. Whole foods plant-based diet, also known as like a healthy vegan diet or a healthy vegetarian diet, people who eat those at baseline are 20 to 30% less likely to develop high blood pressure in their lifetime. The next thing would be movement, also known as exercise. Exercising 150 minutes a week is associated with lower blood pressures, and if you don't exercise and you have high blood pressure and you start exercising, it can lower your blood pressure by as much as 10 points. The next thing would be getting adequate sleep. A lot of people don't sleep well. If you're not sleeping, your body is not able to rest and repair itself, which it does during your REM sleep. So making sure you get somewhere between 6 and 8 hours of sleep is usually adequate for most people. The next thing is avoiding risky substances, and that would be like tobacco and alcohol, both of which increase your blood pressure and just aren't good for you in general. Also increase your risk of cancer, stroke, etc. So eliminating those things can help manage your blood pressure. And managing your stress. We live in a very on the go all the time, high stress, high pressure environment. And so, doing things that help relax your body, relax your vascular tone are good for you. You can do, some people manage their stress via exercise, some people meditate, some people pray, deep breathing exercises. Spending time in nature, it varies from person to person, but having a routine thing that you do on a regular basis, meaning like multiple times a week, if not daily, can help lower your blood pressure. That's just a brief overview. Let me know in the comments if you have any questions or if you're interested in going in depth on maybe like what specific types of foods help lower blood pressure or herbs to help with blood pressure or supplements. Mention in the comments below. Don't forget to share and subscribe.